Emergency Missouri policies will limit transgender health care.
What the AG's decision and this rally circles around is the Missouri Save Adolescents from Experimentation Act. If passed, it would prohibit physicians from performing and referring gender transition procedures to minors. I caught up with Chris Barrett. He attended and spoke at today's rally. He's representing Gays Against Groomers, the Missouri chapter, to show members of the LGBTQ plus community back the Missouri SAFE Act. He says he has no issue with trans adults, but says children just do not understand the long-term consequences.
Most of the kids turn them to just be gay kids or bisexual. And to me, that just feels like we're doing some sort of medical conversion therapy on gay people. And so it's hard for me to support something like that when I'm seeing basically an attack on gay youth.
Now, some disagree. Robert Fisher with Promo tells me, quote, gender-affirming care is health care. Imagine you've worked with multiple medical professionals who all recommend a specific course of treatment for you that is proven to work, but the government steps in and says, no, you shouldn't be allowed to do that. It's insane to imagine us having these conversations about any other form of health care.
Missouri Attorney General Andrew Bailey has announced that temporary rules limiting gender-affirming care for transgender people will go into effect on April 27th. Bailey said the rules, which expire February 6th of next year, are an effort to protect minors from what he calls harmful medical procedures. The emergency regulations prohibit healthcare workers from offering medical gender transitioning interventions unless they ensure someone has exhibited medically documented gender dysphoria for the past 3 years, received at least 15 separate hours of therapy, and resolved any existing medical health issues. Some provisions, such as the ones requiring 3 years of established gender congruity and the therapy rules, do not apply to people who are already receiving gender-affirming medical care. The Attorney General has said the regulations are aimed at protecting minors from receiving procedures too quickly. However, the regulations do not mention only applying to those under 18. Transgender patients and advocates say gender-affirming procedures, including puberty blockers and hormones, have been used for decades and are not experimental. They have accused Bailey of selectively choosing which studies to highlight and ignoring the positions of professional medical organizations which support access to age-appropriate gender-affirming treatments, and say such care is best decided on by patients, their families, and their doctors. I'm going to go and repeat that line again. Gender-affirming care is healthcare.
Well, yep.
I think this is completely ridiculous. It's just like what's going on here in Florida. It started with, oh, we're protecting our children. We want to make sure that our children aren't having procedures that they shouldn't be having. And then it moved on. Now they're trying to keep students in colleges that are federally funded from having health care, as well as us. It just makes no sense.
I want to ask a question in terms of being the naysayer at the table for a conversation. What is y'all's reaction to say we'll do no health care for a minor at all, and anything that has to do with gender affirming care would not begin at 18? What would the consequences of that be? Because that effectively would shut down much of the argument that they are working on to really flush out the real issue is everyone. But they use children as minors as the sword to try to penetrate the armor. So what's the outcome of that?
So the consequences and the outcomes of that are children that are committing suicide.
Yeah, thank you.
Because there are children that know they're trans at very early ages, and you're going to tell them that they're not who they believe they are, and you're not going to try to help them. It makes no sense to me. It's like telling someone they have cancer and, you know what, we're not going to give you chemo.
Right. Well said. Or to say nothing about access to sense of self or like homelessness or access to basic food supplies, or like, I mean, the disproportionate way that people then, trans people would have access to all sorts of danger and violence. Like, I mean, I'm getting worked up because this is the answer. I know you did it to rile us up, but that is the answer is everything. Everything is at stake, right? The disproportionate numbers of HIV/AIDS, right? Like, I mean, it's so much of the problem is that you're right. The child protectionism is the kind of bait here, right? Like that is, if we can just get everyone, like, you know, they're you know, let's send kids to church instead of drag shows, right? Because God knows that no kind of perverse things happen in churches, right? Like, I mean, who are we kidding? Like, the question about child protectionism has always been the kind of bait here because it's effective. As you noted, right, in the story, when you read that story, this is not even, like, it wasn't even limited to people under 18. It's just the kind of framework in which you could then ban things, right? But it's I'll stop.
You agree with that?
Yeah, and I mean, children, for most of these situations where there's a lot of, children are at risk for a lot more things than maybe receiving gender-affirming care. At most youth are receiving...
Gunshots,
Yeah,
Right.
by the
most
way.
youth are just receiving a pause, a break, an opportunity to question and to take the time to discuss with their family, look into themselves and know, is this right, before my body undergoes a puberty that doesn't match.
Right.
And now I have to deal with more dysphoria or more surgery or whatever it is, rather than just, let's just pause this. And puberty blockers have been used in children who have early onset of puberty for decades. That's not new. And none of this is new. And again, we could be working on protecting children from a million other things.
What the real problems are. You know, one of the things that these stories and what we're watching around the country reminds me of in a related way. 1969, when the Stonewall riots happened, 1972, in that 3-year period, LGBT visibility in America raised significantly around the country. A lot of it was still negative, but LGBT basically was busting out of a closet at Stonewall, and it was spreading. Chicago came next, Los Angeles came next, and what was happening that didn't occur until 1972 was the American Medical Association saying being queer is not mental illness.
The psychiatric, right.
And the
APA,
psychiatric,
the American
thank
Psychological
you,
Right.
American
1973.
Psychological. Yeah, okay, so I got everything wrong. 1973.
You often do, baby.
Yeah, and
I'm here to fact check.
thank you. Okay, all right. I appreciate the correction because we want accuracy. So in 1973, mental illness by the psychiatric community is taken off the table. And they have to spend the better part of the next 3 decades making sure that the rest of America comes along with it. It seems to me that that is a similar kind of story of what we're watching in trans, which is the American medical community in so many different ways is saying this is completely understandable, natural, and can be handled in a professional medical way that is constructive and positive. But they're going to have to spend decades of education. Do you think that that's true, that analogy I just gave?
No.
Okay.
Now I just feel like a contrarian. Like I just want to disagree with Al, which is also true. So yes and no is a fair answer. I think that the histories here are pretty different in a lot of ways. For a number of reasons, the trans community has had to have a very kind of unhealthy relationship with healthcare, with medical care in general, right? That is, like, while the gay community, for example, was trying to de-medicalize and depathologize their histories for a number of reasons, right? Trans people also wanted to do that, right? But in order to get medical treatment, they had to actually go under the purview of being, right, having gender dysphoria, for example, right? So that is, it required that in order to be covered by insurance, in order to get resources. So it just established a very different relationship to medicalization, which is we're still feeling the effects of in some ways.
You know, and this may be just a little off, but I want to mention it. When I think about children who've had the care of doctors ever since they were young and had their parents' support, I think of children like Jazz Jennings. Isn't she at Harvard or something
she's
like
at
that
Harvard.
right now?
It's amazing.
And
I just interviewed her mother.
So I know about 4 or 5 other people I'm not just going to name, or we can even talk about our own Tiffany Arriagas, whose mother supported her all the way through her transition, and she went up and got to school and got her master's and is working for an LGBTQ organization. So what I'm trying to lead to is, what about those ones who were not able to have the support of their parents and not be able to medically transition at early ages and things of that, they end up going on to do things on their own to transition. And it ends up steering them down a road
It's very harmful.
that is very harmful, that puts them in danger.
Yeah, well said.
Yeah,
That's a well.
if I could just add to that, parents are signing off on nose jobs. Parents are signing off on breast augmentation, things like that for minors. And those are a form of gender affirming care. Cis people receive gender affirming care all the time. And why don't trans people get afforded that same right?
So now that I think about it, you're right. I know so many people that at 15 and 16, like, ooh, I want some tatas, mom. And their parents are going to get them tatas and nose jobs.
And their body's not done developing yet.
So
Even close.
Well said.
it just really makes no sense.
LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Lara are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.